Hi, this is Vanessa, a California RN, and I'm a master's degree in the Philippines, major in maternal and child health. So this is an example of a case where a pregnancy starts, but instead of forming a baby doesn't develop properly. And instead, a grape-like growth or cyst forms inside the uterus. So, the cells that are supposed to make the placenta grow in an abnormal way and form a cluster of tiny fluid-filled sacs inside the uterus. So, how do we manage this unfortunate situation in women? Management of hydatidiform mole centers on suction curettage evacuation. Another way of saying aborting the grape-like growth inside the uterus, followed by serial human chorionic gonadotropin monitoring to detect post-molar gestational trophoblastic neoplasia or GTN. It is not a cancer, but it needs treatment right away and proper monitoring. This doesn't mean women are irresponsible because this phenomenon naturally occurs in women. All I'm saying is, in this case, this is not criminal, this is a natural occurrence. Just like chicken eggs not meeting quality control and instead forms into an abnormal cell growth. This is not a baby but a cyst. In short, we have to carefully evaluate on a case-to-case basis before we make generalized decisions for every woman to completely halt abortion or dilatation and curettage procedure because we will be endangering their lives unnecessarily. So, the Society of Gynecologic Oncology recommends suction curettage with ultrasound guidance if necessary, with uterotonics administered after evacuation. Hysterectomy is an acceptable alternative for women greater than or equal to 40 years old, those with completed childbearing, or those with risk factors for GTN or gestational trophoblastic neoplasia. Post-evacuation HCG surveillance is critical for early detection of malignant transformation. Weekly HCG monitoring should continue until normalization, followed by monthly monitoring for 3 months after complete mole and 1 month after partial mole. Recent evidence supports this abbreviated surveillance for patients with normalized HCG. The National Comprehensive Cancer Network recommends HCG assays every 2 weeks until 3 consecutive normal values, then monthly for 6 to 12 months, with 3 months considered if normalization occurs. Effective contraception is essential during the surveillance period with systemic hormonal contraception, particularly oral contraceptives. Medical evacuation methods should be avoided due to high failure rates, hemorrhage risk, and increased development of GTN requiring chemotherapy. For patients who develop post-molar GTN, treatment depends on risk stratification using the FIGO staging and WHO prognostic scoring system. So there, we screen these women to make sure they don't develop cancer or GTN. So thank you to Open Evidence AI for helping me with research, and attached here are my resources. Thank you.